Okay, good afternoon, everyone. Let's go ahead and get started. Thank you for being here today with us for our presentation entitled Creating Zines about Alzheimer's Disease and Dementia for American Indian and Alaska Native Youth Caregivers. We are thrilled to share the results of our project with you today. I'm Erin Poole, a research instructor and associate director for the Centers for American Indian and Alaska Native Health at the University of Colorado Anschutz Medical Campus. I am joined by my colleagues on this project today, Nathania Sosi, Associate Director of the Center for Native American Health at the University of New Mexico, Candice Garcia, Health Sciences Research Specialist at the Center for Native American Health at the University of New Mexico, Krista Schaefer, researcher with South Central Foundation, and Georgiana Aguino, one of our young adult zinesters. Next slide, please. We would like to start this presentation in a good way with humility and proper recognition, so I will share our land acknowledgement. Let us take a moment to think about the land you reside on, the people, the landforms, the trees, plants, animals, rocks, and all living things. The Centers for American Indian and Alaska Native Health is in the foothills of the Great Rocky Mountains in what is now called Denver, Colorado. It is the traditional unceded territory and ancestral homelands of the Cheyenne, Arapaho, and Ute nations. We must also recognize the painful history of genocide and forced removal from this territory. We pay respect to the diverse Indigenous peoples still connected, living, thriving, and upholding the sacred connection to the land in all the Turtle Island. I encourage anyone hearing this to pay respect to elders past, present, and future, and to those who have stewarded the land you are on and the water you use for many generations. Next slide, please. All right, our objectives for the presentation today are to provide you with an overview of the Center of Excellence in Alzheimer's Disease and Related Dementias, which was funded in a grant by NIMHD, which we will talk a little bit about. And we want to talk a little bit about our Zine project and some of the other projects involved with this. We'll also provide background and the process of the Zine project's inception, share some of the zines created throughout this project, and finally, we'll end by sharing some of our challenges and successes on the project. Next slide, please. So Alzheimer's disease and related dementias have become major health concerns in American Indian and Alaska Native communities. Tools for screening, treatment, health literacy, and prevention are available to American Indian and Alaska Native communities, but very few of these tools have been developed specifically taking into account the unique strengths, challenges, and considerations of Indigenous communities. The Center of Excellence in Alzheimer's Disease and Related Dementias was funded by the National Institute on Minority Health and Health Disparities back in 2017 to develop specialized approaches to addressing Alzheimer's disease and related dementias in American Indian and Alaska Native communities. The Center of Excellence is built on a precision medicine framework, which engages us in a targeted, personalized approach to addressing ADRD, and very intentionally uses the known strengths and challenges of Indigenous communities to focus and tailor projects. The Center of Excellence partnered across private, tribal, and public constituencies to create projects and research programs addressing cognitive impairment and dementia that are scientifically rigorous, culturally informed, and tailored, and patient-centered. We also leverage a network of 5 satellite centers across the country to ensure community stakeholder involvement in planning projects, designing projects, and implementation. And finally, they support dissemination of the results of the work. Next slide, please, Candice. The Center of Excellence is comprised of 5 components, 3 cores and 2 empirical studies. The administrative core supports logistical and field operations across the center's research projects, cores, pilot studies, and academics, as well as community partnerships. The investigator development core provides financial, logistical, and scientific resources to support innovative pilot projects that will generate preliminary data for subsequent grant applications. We have a research project that's using data from the Strong Heart study and ancillary cerebrovascular disease and its consequences in American Indian study, CDCAI, to evaluate cognitive function, Alzheimer's disease risk factors, and MRI-defined biomarkers. And that is specifically, those projects are specifically in American Indian, Alaska Native elders. Our second research project is empirically testing different approaches to the recruitment of American Indians into research studies, and that study is based in South Dakota. Today, we'll focus on the Community Engagement and Dissemination Corps, which functions to understand local, regional, as well as national priorities related to cognitive impairment, dementia, Alzheimer's disease among American Indians and Alaska Natives. And this Corps also functions to disseminate the results of those projects across the Center of Excellence to the scientific community, to health professionals providing care to American Indian Alaska Native patients, and to American Indian Alaska Native communities, with the hope of affecting practice change and raising awareness. Next slide, please, Candace. As I mentioned earlier, the Community Outreach, Engagement, and Dissemination Corps is made up of 5 satellite centers across the country. This map shows the regions covered and where each satellite center is based out of. The group of presenters today represents 3 of the 5 satellite center regions. Krista is from Alaska, Nathania and Candace are from the Southwest region, and I am from the Rocky Mountain region. Next slide, please. Our Community Action Board supports all of the Corps and research projects for the Center of Excellence. It's made up of local and national stakeholders representing community partners, health service providers, public health agencies, policymakers, and other key stakeholders. The Community Advisory Board members are nominated by Satellite Center leads to be part of the project. The Center of Excellence and Satellite Center leads meet with the Community Action Board at least twice a year and more as needed. And they have been integral to Precision Medicine Framework by providing guidance about tailoring projects and our dissemination products. Next slide, please. The Community Engagement and Dissemination Corps has undertaken 2 primary projects. The 88 project, which involves working with our Community Action Board to culturally tailor a widely used 8-question Alzheimer's disease screener for use with older American Indians and Alaska Natives, and then piloting the tailored screener with over 700 American Indian Alaska Native elders across the country. And then the Zine project, which we'll focus on today. And I will hand it over to my colleague, Krista Schaefer, to describe that project to you.
So why are we doing zines about Alaska Native and American Indian people who may have dementia or Alzheimer's disease? So the population of older American Indian and Alaska Native people is growing. And because that population is growing, there's also an increase in late in life illnesses, which includes the cognitive changes like Alzheimer's disease and dementia. And because these are newer in these communities, there is less clinical resources for our elders experiencing Alzheimer's or dementia in many places like reservations or rural Alaska Native villages. So if there's not clinical resources, then there's definitely community resources. And the community resources are family caregivers. And so in many of these Alaska Native and American Indian communities, multi-generational households are really common. So these caregivers are not just maybe what we think of as the aunt, the daughter, the son, but they also include the cousins and the grandchildren. So our Community Action Board tasked us with creating health promoting messages about Alzheimer's disease, not for the elders, but by youth and for youth, which brings us to the methods of our project, which are twofold. So the first one is we held listening stories. Go ahead, next slide, please. And these are listening sessions. So we brought together youth from the 5 sites who had a family member with some sort of dementia to talk with each other. And really once they got going and sharing their experiences, it was a back and forth of like, oh, that's what I had too, or this is my story about. But we also had some question prompts for them, like, what did your family and you first notice about their memory change? And we ended with like, what tips would you have for other Alaska Native and American Indian youth who might start being a caregiver? And from there, after those listening sessions, we asked for volunteers to create a zine, which is a self-published periodical. But before they did that, they went through 2 trainings. So Jesus Fuentes led the first training on storytelling, which for our community was just perfect because there's such a culture of oral storytelling that he went through and kind of helped develop, each person develop their own story. And then Becky Jones met with everybody and she creates zines too. So not only did she show us many examples of zines, but she took us step by step through how to create one. And then at the end of that, we asked our youth if they would be willing to make a zine about caring for their loved one with dementia. Oh, Candace, you're on mute. 1 second.
So our site actually labeled our listening sessions as talking circles. We invited the young caregivers to talk about their experiences as a caregiver, like Krista said. We hosted these sessions because research has shown that young adults are more likely to listen to health promoting messages from their peers. So our goal was to facilitate opportunities for young caregivers to reach other young carers. And we wanted young caregivers to feel a sense of support and connection with everyone that was invited into the circle. We also wanted to provide a way for them to share their experiences and advice to others who may be new to the caregiving scene. Once our sessions were complete, like Krista said, they had the opportunity to create a zine. So we chose zines because they are homemade publications. Young caregivers could share their personal stories through words and pictures without any input from anyone else. It was solely all up to them in terms of adding content, pictures. Sharing stories is also important in American Indian and Alaska Native culture because we use them to communicate with others, and it's also passed down through future generations. Zines also help keep the stories alive and it allows them to be shared with others. Zines are also tangible. So people who create the zines were called zinesters, and the zinesters had complete control over what they created. And in a few slides, you'll see an example of how we helped the zinesters create an electronic version of their zine, and they're able to control how they wanted to disseminate their zine from that format. So the purpose of the listening sessions were to get a sense of whether this is really an issue for young caregivers and learn about its importance. We wanted to learn about some recommendations that young caregivers had for other carers with hopes of implementing those recommendations in the future. We also wanted to generate communication or conversation around the experience of caregiving. Since it's such a small group, it was really hard to find folks who were in our specific age category that were caregivers to people who had experienced memory loss or had memory loss. So during these sessions, we asked young carers when they first noticed the signs of memory loss. And some of them shared stories about when they first noticed memory loss in the person that they were caring for. So one person stated that their grandma would go and sell jewelry in Santa Fe, and sometimes she wouldn't remember what she sold or how much she made on that specific day. So by hosting these sessions, we got to learn about different perspectives, and all of the participants had different stories about how they first noticed the signs of memory loss in the person that they cared for. Some youth said it was difficult to describe ADRD. The specific question we asked was, how would you describe Alzheimer's disease or related dementia or memory loss to someone who was younger than you? One participant used the movie Finding Nemo to teach their younger family member about memory loss. They compared their grandma's memory loss to the character Dory, who also had trouble remembering things.
So then they got to make a zine, and this is what we hope really applies to you and your organizations. There are many, many different styles of zines, and we chose the one that you could do with any sheet of paper next to you, whether you're going to rip it out of your notepad or grab a sheet of printer paper. We use the printer paper because of the reproducibility of it. So our zinesters could create one, scan it, and have it as a PDF, and they can email it to their friends or whoever they want to, share it with, and that person can print it out, fold it in the same way, and have a booklet. So a really nice and way to do it that is easy, inexpensive, and very reproducible is using like a printer sheet. So if you want to do the same thing, these are the directions for making, folding up your zine. We didn't need scissors. We did a little tear on the step in the middle of this diagram. So less equipment is needed. And then ours was really free reigning. So the first one we did with the trainer, on page 1, she had a prompt, and, so there's 6 pages for them to fill in. And she had a little prompt for each one, which I think was really nice and something that you can take back with you. But let us show you some of our zines now. So this zine was created by Luke Lehman, and he was really generous and gave us permission to share this with you all. I know it's kind of hard to see on the screen, so I'll take you through some of it. But Luke created a zine titled My Greatest Elder. And in the first few slides, he introduces his aunt, where she came from, what she likes, and he really focuses in on how they spend time together. And it's by her reflecting on her past. And then he kind of transitions to pointing out some things that are really hard for her and how he kind of tries to step up and help that out. So a lot of reassurance. She struggles with doing the craft she used to, so he helps her craft. And then 2 lines that I want to quote directly from him, how he concludes it is how it's really worth it for him and kind of his encouragement for other youth. So he says, "It is a family team effort to look out for my aunt. Her home is where we all still come together," which I think is really beautiful.
So another one of our zines is actually from the Southwest Satellite Center. The zine is titled I'm Sorry. It was written by a young woman in New Mexico. One of the key features of the zine is that it is owned, distributed, and published by the zinester. And in order to honor the zine tradition of ownership, we wanted to carry those same principles over into the digital space. So if you would like to view the zine from your personal device, you can scan the QR code up in the top right corner, or you can visit the link posted in the chat. The zine will be available for a few hours after the session, then it'll be password protected by the owner. But I'd like to just skip through some of the pages. You can also look at it through your own device if you'd like. This zine is about a young carer, and they notice the different stages of Alzheimer's and the person that they were caring for. Their story also noted that the person that they were caring for would also always apologize for their actions. So the zinester used their zine as a tribute to their grandma and wanted to educate people about what they went through as a young caregiver. Hence the grandmother, you have nothing to be sorry for. And the next zine is actually from Georgiana Owino. She is here with us today, so I will let her explain what her zine is about.
Hey everyone. So my zine is about remembering to take care of ourselves as young caregivers. I think especially as Native women, we carry a lot of responsibilities on our end. So I wanted to recognize that we can't pour from an empty cup. So I wanted to create a zine about just, taking care of ourselves while we're also taking care of our family members. And I tried to do something more like uplifting and fun, because it can get very difficult to care for others, especially elders. So I kind of went with like, something to really simple, but also bright and colorful. And I think when I first thought of what zine to do, I wanted to do something um, like to give advice to other caregivers. And then I think it was kind of like also internally telling myself to take care of myself while I'm taking care of my grandma.
Okay, so you've just heard about the successes of the Zine project at the Alaska and Southwest Satellite Centers in those regions, but not all of the satellite centers were as successful in implementing this project. So we have a few lessons learned very briefly, so we can move to questions. In the Rocky Mountain region, my colleague Gracie Redshirt Tyon led our efforts with youth to develop zines, and she was able to successfully recruit 2 youth to participate, but engagement with the youth was much more difficult than we expected due to factors that were totally out of our control, like parental permissions and students switching schools and just losing contact with them. Additionally, a significant structural constraint is the urbanization issues that natives face, at least in Denver. This was an issue for us. It can disconnect youth from cultural heritage. It makes it hard for them to understand and see the benefit of raising awareness through a project like the Zine about chronic conditions that are affecting elders in their communities. We also had a lack of opportunities for Native youth to come together in our region, which made it hard to talk about the project generally. And so those were some of the challenges that we faced, as well as just a reluctance to share personal experiences about caring for an elder out of respect, especially sharing those experiences with an adult who's outside of the community. Next slide, Candace. All right, we couldn't do this work without our colleagues who couldn't be here with us today. We want to especially acknowledge Dr. Kaimi Sinclair, Pacific Northwest Satellite Center lead from Washington State University, who was the original proponent in our group of the Zine project, and our Center of Excellence principal and guest investigator and Rocky Mountain Satellite Center lead, Spiro Manson, who's here with me in Denver at the University of Colorado, and the Zinesters, without whom we could not have had any zines to share today or have this wonderful project. Okay, next slide. Many thanks to you all for your attention to our presentation. We'd be happy to answer any questions you might have.
Just confirming, Erin and team, that there are no questions right now in Q&A or in the chat.
Just put my email in the chat. Others may choose to do so as well in case people come up with questions afterwards or have an interest in learning more about the Zine project or the Center of Excellence.
There's one question in the chat. Maybe we have time for that, Erin. There was a question: how do we plan to continue the work?
Yeah, so that's a great question. The work of the Center of Excellence will continue. We are nearing the end of our project. We expect it to be done in April of 2024 with this topic area. Our goal for this year is to share as much of the information locally, regionally, nationally at events like this conference, but also with those individuals who supported this work throughout the last 6 years. and try to raise awareness and also seek guidance from communities about what the next step should be. So our work is always community-based, and that's how this project originated, was ideas and needs as shared by community members in the regions that we serve. And we were lucky enough to be able to receive funding to come together and put into action some of those projects. The other project that we talked very briefly about was the 88 screener, and that is something that we would like to continue in terms of piloting that with a larger group of people and potentially comparing it to other non-Indigenous groups. So I hope that answers your question.
Thank you, Erin. And there we have a question from the Q&A. I think you might have answered it as well. Are you going to expand the project to other areas?
Pardon me, we would love to. So we are absolutely able and willing to partner with regions who have a need and a desire to partner with us. And so, yes, we are open to that. And with a new round of funding, would definitely seek out partners in other regions to work on this. This is clearly a national and international issue related to Alzheimer's disease and related dementias. And so, yes, we're always looking to partner.
I think we already have another grant starting with new Zines on diabetes. And so I think we had a question earlier about other chronic diseases. And I'm not sure if we can say, oh yeah, this would be great for X, Y, or Z chronic disease, but trying to identify the audience that this really, which is something we're still figuring out. Now moving forward with Zines and diabetes.
Thank you. One more question. What's the level of awareness the adults have of what might be coming? Could the information be repackaged to help those in early stages cope and prepare?
Yeah, I mean, I can share a little bit about experience in our region. So, I mean, I think raising awareness is something is definitely needed. This is an kind of an underrepresented chronic condition, at least in the Rocky Mountain region. I can definitely speak to that. And as we talked about briefly, there are not really screeners and tools that are specifically tailored to be used in American Indian Alaska Native communities. And so that was one of the goals of this project, of the overall Center of Excellence project, was to try to provide resources that are accessible and will be more widely used. And the other piece of it that we are working on through this project and other similar projects is to generally raise awareness with elders about some of the risk factors, signs and symptoms, what to do about it, and how to access care. And so it just varies. To answer your question directly, it varies what people know. And absolutely, there are always ways for us to share more broadly information. We do have a project, without getting into too much detail, that many of us presenters are part of, that's called the Brain Train, which imagines a really interactive way of being with elders to learn about brain health and general physical health.
Thank you. There's one last question, I think. Aman Kar says, thank you for sharing this method of storytelling and self-publishing. Were the zines also used to communicate health-related facts within the stories? Candace, do you want to address that?
Yeah, so this is for our satellite center, Southwest Satellite Center, the zine that was created zine actually used the stages of Alzheimer's. So the author aligned those stages with what she saw with her grandma. So of course, it's going to be different for all the signs and symptoms for everyone. But if you look back at the zine, there are different moments and different issues. So early on, it was short-term or small things that she would forget. And then later on, it got progressively worse. So it could be used for fact if we have the appropriate health information. Thank you.
Thank you. I believe those are all of the questions from chat. I just want to add one more, read one more comment about libraries have been building zine collections for a while. How about working with libraries to promote and fund the projects? Any responses?
Yes, is my response. I think that's a great idea.
Thank you, everybody. Those are all the Q&As.